Today we'll be demonstrating an example using the Quick Start feature on the Sai platform. To begin, click the Start Recording button underneath the Quick Start section, and Sai will immediately begin recording the encounter. Hi, what brings you in today?
Hi, doctor. I've been worried about my periods because they've been really irregular lately.
How irregular are they?
Sometimes I skip a month or two completely, and then when I do get my period, it's either really heavy or lasts much longer than normal.
I see. Have you noticed any other symptoms?
Yeah, I've been gaining weight even though I haven't changed my eating habits much, and I've also been getting more acne than usual, especially around my jawline.
Alright. Anything else? Changes with hair growth, maybe?
Actually, yeah, I've noticed more hair growing on my chin and stomach, which has been really embarrassing.
I understand. Those symptoms can be frustrating. Based on what you're describing, one possibility is polycystic ovary syndrome, also known as PCOS.
I've heard of PCOS before, but I don't really know what it is.
PCOS is a hormonal condition that affects many women, especially during their reproductive years. It can affect your menstrual cycle, hormone levels, weight, skin, and even fertility in some cases.
Do doctors know what causes it?
We don't know the exact cause, but genetics and hormone imbalances seem to play a big role. Many women with PCOS also have something called insulin resistance, which can make it easier to gain weight.
That actually explains a lot. I've felt like no matter what I do, losing weight has been so difficult.
That's a very common experience with PCOS. It's not simply about willpower or eating too much.
Honestly, it's been stressing me out. Between the acne, the weight gain, and my periods being all over the place, I barely feel like myself lately.
That's completely understandable. PCOS can affect both physical and emotional health, so it's important we look at the full picture.
Does this mean I won't be able to have kids?
Not necessarily. Some women with PCOS do have difficulty getting pregnant because ovulation can become irregular, but many women with PCOS are able to have children, sometimes with treatment if needed.
That's a relief. I was really scared about that.
I understand, but right now the first step is getting a proper diagnosis.
How do you diagnose it?
We usually combine your symptoms with blood tests to check hormone levels, and sometimes we do an ultrasound to look at the ovaries.
Does everyone with PCOS have cysts on their ovaries?
Not always. Despite the name, some women with PCOS don't actually have cysts. The diagnosis is based on several factors, not just the ultrasound.
Okay, that makes sense.
Have you also been feeling more tired than usual?
Yeah, actually, I'm tired a lot, even when I get enough sleep.
That can happen too, especially if insulin resistance is involved.
So if I do have PCOS, how is it treated?
Treatment depends on your symptoms and goals. Lifestyle changes like regular exercise and balanced eating can really help manage symptoms.
I've tried dieting before, but it's discouraging when nothing seems to work.
I understand. With PCOS, even small lifestyle changes can make a difference, but it often takes time and consistency. You don't have to do everything perfectly.
That's good to hear.
We also sometimes use medications. Birth control pills can help regulate periods and improve acne, and other medications can help with insulin resistance or unwanted hair growth.
Are those long-term treatments?
Sometimes, but it depends on how your symptoms respond and what your health goals are.
Okay, honestly, I'm just glad to finally talk to someone about this. I kept thinking maybe I was overreacting.
You're not overreacting at all. Your symptoms are real, and it's good that you came in to get checked.
Thank you. That makes me feel a lot better.
Of course, we'll run some tests and work together on a plan that helps you feel healthier and more comfortable.
All right, thank you, doctor.
You're welcome. As you can see, Sai has now generated a new note based on the new template that you selected with the same encounter information. You can now edit the visit name, reason for visit, room number, and other patient information as needed. You can also select from existing patients to add to the note, and once complete, you can save visit and find it on the patient dashboard.